Alrighty, so we'll be working with instrument-assisted soft tissue mobilization, which includes both cupping and scraping along the bottom of the foot, a very common area for a lot of people to have some either pain or discomfort in. Or heck, you just worked a long day, maybe you want a little TLC, this is a nice way to do it. So, like with our other videos, first thing I start with is just a little easy application. Sometimes it goes on the first time, sometimes it doesn't. So now that I got a little bit of suction and it's applied firmly to the bottom of her foot, I can just twist back and forth gently. I'm not trying to go 360 here. I can go up and down, diagonally, just to help starting it to loosen up. Since I've got it attached, we can now also add movement where I can have her curl her toes back towards herself and then curl them down. And then back towards herself, and then down. We would like to stretch the entire muscle at once, but if there is dysfunction, maybe we can only do one section at a time. And I like to believe that once the cup comes off, the work of it is done. So for her, as she curled her toes back, the cup came off. That tells me that area is done being treated. Cups, from my experience, others may differ, do not stick as well as to bony areas like the heel or across the ball of the foot. That being said, I do like to just try and stick in the middle here where there's a little more meat. So if we take a little gel now and we try and do a little more active movement, it's not going to be as wide of a movement because it's a smaller area, but bigger people, bigger folks, you'll be able to work through a bigger area. So we apply again, and I slide back and forth. Very gentle. Typically, there are more issues along this inner arch than the outer, but you work with what you've got. This might be more considered general work. So from there, maybe I use my little scraper to work on the intrinsics of her foot. So knowing that the inner arch is a more troublesome area, I could start gently. I do feel a little crispy up at the top here. If your feet are ticklish, this is a nightmare for you. Sonia is being a very compliant patient and not kicking me in the face. I appreciate that. So now that we've started a little generally, we can move to be more specific with the tip of the tool rather than the belly. And again, I feel a nice little crispy crunchy there. We give it a little attention. I'm not trying to break up scar tissue. I'm just letting gentle pressure do the work. She's not going to come out of here with bruises. She's not going to come out of here with any long-lasting redness more than a few minutes. And then again, we finish off with a wider portion of the instrument to end the treatment. I would always like to follow this up with exercise, but if you're just using this for TLC, let your feet relax after this. Take a minute and reflect on the day. You've had a lot of time to think right now with the pandemic, but how long have you thought about yourself for? Chesapeake Bay Aquatic and Physical Therapy. Stay safe, folks.